Mayan Calendar. Why is the Mayan Calendar in the news recently? Did you know that the Mayan Calendar stops December 21st of 2012? Okay, so don't have to buy Christmas gifts, okay? Can save money. So really why, it's really just to say this. What does it look down the road? Well, here's what it looks like beyond December 21st, 2012. Here's what the future looks like. It looks like these directly active viral agents. It looks like new interferons. It looks like new ribavirin, fewer side effects. So, interferon, what's new? Why do I have Huey Lewis in the news? They had a song. Do you know what that song is? It goes, I need a new drug, one that doesn't make me sick, one that doesn't make me feel 3 feet thick. Remember that? Okay. I date myself. Okay. I should have said, and now back to the future. Okay. PEG interferon, so we know pegylated interferon, it's alpha interferon. 90% of the side effects are from this drug. Here's a new one. There's a new interferon. It's called lambda interferon. It's a new form that has fewer side effects and appears to be equally effective. So clinical trials evaluating. Here's one clinical trial, and I know this is a busy slide, and what they've done here is they've got the present interferon here and this new lambda interferon here. And they looked at what are the side effects. Here they are. Myalgia. Malaysia's a country, Wayne. Myalgia is, so they said in the study, I can't believe that myalgia was only 30% of the study, but it was down by 2/3. So you had a third, far fewer side effects of this sort of, I feel flu-like fever, a quarter of the, as much. So you had far less feverish, flu-y kind of symptoms. Risk of developing anemia. It's a half of what you would with interferon. The risk of getting a reduced white cell count, very little. And here's the one that I like, platelet drop, almost non-existent. So if I have patients with advanced liver disease and thrombocytopenia in which they go, ooh, that's not a good, ooh, your platelets are 50, maybe we shouldn't treat you, too bad, we'll send you for a liver transplant. Maybe we can now treat these individuals. What about the other new class, the directly active antivirals? There's actually 3 validated targets and 4 classes of DAA. So here are the 3 targets. They are the NS5A inhibitors, the NS3/4A protease inhibitors, and the polymerase inhibitors. Okay, here's where they happen in the cells here. So we've got this group here, that one right here, and on the 3rd class. They all work in different sites. Interferon does not kill the virus. It's somehow, we're not sure what it does, but it does something to your immune system so you can help to fight it. These drugs actually attack the virus, okay? So there is the huge list of, one potential huge list of all the new medications. There's a once a day. These drugs are taken once a day. These drugs are taken twice a day. These drugs are taken 3 times a day. But the exciting news is some patients only require 12 weeks of treatment. And there's some data say 12 weeks of treatment without interferon. You take pills. Does that interfere with your work? No. Does it make me sick? Maybe a few side effects remain to be seen. So how do we evaluate these new medications? It says, how are these available? We can make them available through clinical trials. What is a clinical trial? It's where you're one of these. What is that? What's that word? Guinea pig. I hate guinea pigs. Why? Is because my daughter asked for 2 of them. They stunk up in the bedroom for months. And finally I had to give them away because she got a dog. So yeah, people say, oh, am I a guinea pig? Actually not. So what is a clinical trial? It's a where a manufacturer of a new medication is evaluating the safety and efficacy of new medications. Patients volunteer, they come and see and say, yes, I'm willing to get this treatment. And these medications are then evaluated. That's how every single medication has become available in Canada. That's how interferon, ribavirin, boceprevir, tenofovir, everything, any medication you're now on or ever will be on, you got to go through this. The meds have to go through this. So clinical trials that are up and coming, so we're looking at new oral medications, new interferons. So what have we done here in Victoria to date? We've enrolled at least 140 patients on 8 clinical trials. Some of them are for patients with low platelets. Some of them were patients who needed to be evaluated for more prolonged therapy. Some of them were some of these new directly active antiviral agents. They were for genotypes 1 or 2 and 3. Success rates have been encouraging. We're still waiting for this, but suffice it to say that with the clinical trials, this is the big term people say. They say, oh, is there a placebo in there? And yes, there may be a placebo, but your minimum you will get is what PharmaCare will give you as the maximum, okay? So anyone goes on a clinical trial today will get everything that PharmaCare or I can write you a prescription for plus something else. So summary to date, we've got BMS with an NS5A inhibitor, we've got a Roche protease inhibitor, BI protease inhibitor, and the advantages are these new treatments are now down to 24 weeks instead of the 48 weeks. And this we've heard with some of the new treatment, and we've got patients who are genotype 2 and 3 only required 12 weeks of therapy. So what clinical trials do we have available now, and what are we looking for now, today? We're looking for people who are interested in this interferon that has far fewer side effects. We're looking for patients who have HIV and Hep C co-infected. That is a tough problem. I've got many patients who sit in that category, and they all say one word, no, or 2 words, no thank you. They're so far don't appear to be interested, though I do have some. And I try to tell these individuals that please don't wait until it's too late, because if you get advanced liver disease, I cannot help you then. I'll have to refer you to a specialist who will look at whether you're a candidate for a transplant. We've got the non-interferon based using only oral medications. Here's a trial where you're only going to get pills, okay? No interferon. So we've got a trial there. So we are looking for those. So future treatment, final slides. Future therapy we're looking at great results, only 24 weeks, up to 80% success rate. Hepatitis C treatment in nurses, I want to recognize our nurses, Fran and Leanna here in this room. Do we have anyone from Up Island? No, Michelle no, it's not here. Sorry? Vancouver. Thank you. So what do the nurses do? They will not only show you how to treat it, they will call you. They will be your advocates. They will help you fill out that disability forms that Dr. Ghesquiere seems to lose in his stack somewhere. And a month later, you get my secretary to pull it out. You advocates for you. They're compassionate. I've got many individuals who just sing the praises of all the nurses here and say, what can I do for them? And so really when it comes to Hep C therapy, what I always say is, I see you, hand them over to the nurses, that I bring you back and say, geez, you're cured, didn't I do a great job? When it's really the nurses who did it. So I talk about, through Percuro Clinical Research here in Victoria, we've enrolled quite a number of patients. Research also exists, I want to make that clear, in Vancouver as well. So we've talked about clinical Percuro, so they do GI, rheumatology, dermatology, infectious diseases, and infusions. So this is a clinic here, at least in Victoria, on Vancouver Island. We certainly welcome people from Duncan, welcome people from Nanaimo, the whole island. So if you want to be seen, you need to be seen, we're here for you. And just to sort of say, I'm happy to see patients. I do not have a long waiting list at all. I scare everybody away, I guess. So, burden of hepatitis C, what is it? We've heard all about it. Mortality, frequent cause of transplant. Here's your last 4 comments I want to say. Don't forget, high success rate, patients evaluated, get it done, don't let your liver disease progress. Liver enzymes by themselves, so you gotta have that biopsy or FibroScan. There's lots of new treatments. There are new treatments here today, now. This is the complaint department, so please take a number. So thank you very much, and I will entertain probably 0 questions because I cannot believe, but I spent exactly 1 hour, which is what I was given.
Okay. Just have a seat, Dr. Ghesquiere, for questions. Okay, we do have time for just a few questions, and my heart is now back in my chest because Dr. Farley walked through the door. So what we'll do is get Dr. Farley to sit up for the next session while Dr. Ghesquiere answers questions. Yeah, that's great.
Yeah, go ahead.
Yeah. Okay. Yeah, we'll just get you set up.
There you go, John.
Okay. Perfect. Okay.
Hi, Serge Melcourt, and I'm 6 years post-liver transplant recipient. And my question, quite frankly, is you touched on age and progression of disease versus treatment. I was diagnosed early stage 2 fibrosis through a liver biopsy 2 years post-transplant, and I requested another biopsy, which they honored, and I was still at early stage 2 fibrosis. Now, I don't know, as of yet, there's no clinical trials for transplant patients, although it might be around the corner. But what, in your mind, would be the criteria for 64 years old, is early stage 2?
Stage 2, and you've already had 1 transplant.
Yeah.
You probably are contact. Whatever I tell you will probably be wrong, because I don't take care of patients with transplant. You probably are managed by the group out of Vancouver.
Yes.
So, have you asked them this question?
Well, I'm going there on Monday, so I wanted to do some additional research because they did tell me the last time that I was there 3 months ago that unless my liver was at risk, they wouldn't treat me.
Yeah, so we put on treatment. So, Rob, you taking care of patients with transplants, yes?
Yeah, a little bit. I mean, it depends on how long. Maybe it depends a bit on how long ago you were transplanted. It's
6 years.
Okay, so do you think you've gone from sort of stage 2 or 0 to stage 2?
Quickly, and I haven't progressed.
You sort of stop at stage 2?
Yeah.
Yeah. So, I mean, I think a close follow-up is going to be necessary because, you know, over 6 years progressing like that much. If you're progressing more, for sure you should undergo antiviral therapy if available, probably in a trial.
Okay. Thank you.
Okay. Any other questions? We'll just take 1 or 2 more and then we'll have to move on.
I heard you mention something about that you haven't been turned down for being funded for anybody has been funded. Was that correct?
I'm sorry, what is your question?
You mentioned that nobody has been turned down for funding.
Well, that's right. That would be my personal. I can't talk about every patient that exists in all 47,000 in British Columbia. I can just tell you the patients who I've had, who I wanted to start them on treatment. Not one has ever not had treatment done because they could not pay for it. We always managed to find some way of getting funding taken care of.
Okay.
Okay. Just one more question.
In HIV, they use reverse transcriptase inhibitors, and something that prevents the binding of the virus to the CD4 cells. Have they tried that with HIV, with Hep C, or is it even disappointing, or?
Yeah, so the medications we use for HIV do not work for hepatitis C. The medications we use for HIV are, at least some of them, are very effective against hepatitis B. Okay? So, which is very nice about, I've got a number of patients who are co-infected with HIV Hep B, and I use one nice drug, covered the whole.
Okay, thank you. Thank you, Dr. Ghesquiere.